Hello and welcome to the Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations in this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope that the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in this episode, we discuss genital warts. Now, I know what you're thinking. Why genital warts? Did you know that nearly 400,000 people are diagnosed with genital warts every year? And that doesn't even include all the people that have genital warts and don't even know it. Is there any wonder that genital warts are one of the most common types of sexually transmitted infections? But how are genital warts transmitted exactly? What causes them? What do they look like? And how do you know if you even have them? And if you do know you have them, how can you get rid of them? To answer these questions, we turn to Dr. Jules Lipof. Dr. Lipof is an assistant professor of dermatology at the University of Pennsylvania. He earned his medical degree from the Albert Einstein College of Medicine and completed his dermatology residency at the Montefiore Medical Center. He is also a member of the American Academy of Dermatology. And now I bring you our conversation with Dr. Jules Lipof about the management of genital warts. Hello and welcome to the Better Man Clinics. Today we're going to be talking about genital warts, a sensitive subject that a lot of men are concerned about, but are maybe too embarrassed to talk about and often don't know where to even go to seek care. Fortunately, today we're joined by a true expert, Jules Lipof, who is a board-certified dermatologist and assistant clinical professor of dermatology at the University of Pennsylvania. Dr. Lipof, welcome to the program.
Thank you very much for having me. It's a real honor and happy to help clear up any questions about warts.
Perfect. Well, we're going to be asking you plenty of those for sure, and many of the ones that we hear over and over again. But before we do that, we'd like to just kind of get to know you a little bit better. And one question we'd like to know is kind of what inspired you to become a dermatologist? How did that become your passion?
Well, I don't think I grew up dreaming of being a dermatologist. I didn't even really think of it as a field or know much about it until medical school. But I think what drew me to it is how concrete it is as a field. You know, what you see as a practitioner is you're examining the external part of a body. You know, we talk about internal medicine, and internists look at the black box of the human body and they listen with the stethoscope, they tap, they take blood tests, and they try to put together what could be going on. It's a mystery, and they infer. And I like that, but dermatology is actually a lot more Sherlock Holmesian. It's seeing where is the rash, where isn't the rash. You know, there isn't any debate whether the problem is better or worse, or whether it's there or not, because you see it or you don't.
Right.
So that concrete nature of like external medicine, but really appealed to me. And it has this history because it's so external. It's a lot more old school. There are a lot more bedside tests. There's looking at a patient and telling them immediately, you have this, and didn't even have to do any tests. So that's very satisfying. And, you know, otherwise it has like a great schedule, and we see patients from children to the elderly. We get to procedures. I get to interact with all sorts of different fields, and it's great for academics. So it's really worked out great.
That's fantastic. Well, it sounds like a fun field. And so one of the things that I'm sure you see of not a small amount is these genital warts that we're going to talk about. And one question I'm going to have, it's going to sound like a silly question because most people have seen a wart, know what a wart looks like. But what is a wart? If you look under the microscope and as a dermatologist, what do you think of when you think about a wart?
Well, a wart, first of all warts are caused by HPV viruses, human papilloma viruses. So every wart is an infection that is passed from skin to skin, human. So no matter what kind of wart, genital wart or other wart, they're all caused by different types of HPV viruses. There are hundreds of them. Now, there's definitely a stigma about genital warts. People are embarrassed, etc., about having them, but they're just common. Like, we probably are all exposed to many of them all the time. It's just, as individuals, some of us are not as good about recognizing them in our skin. So our immune system may miss and let them grow into these bumps, right? So to me, a wart is just a little cluster, a little growth caused by a virus that your immune system just for some reason doesn't see it's there. And so it's allowed to exist.
Interesting. I bet most people don't think about it that way, about how it's caused by a virus and whatnot, just by seeing something on their skin. And when we talk about genital warts, obviously we think about the genital area, but are there specific areas in men, like in the genital area, that genital warts pop up in?
So I mentioned that there are all hundreds of kinds of HPV viruses. So each of those viruses has parts of the human body that they like to infect. So there are ones that only do like the hands and the feet. So the ones on the hands and feet are not going to move from your hand to your genitals, right? Likewise, the ones that like to be in the genitals, really anywhere in the genital area, but for a man, that would be on the penis itself, like the shaft. It could be the scrotum. It could be around the anus and even into there. And the area between the anus and the scrotum, which we would call the perineum, or, there certainly are more casual terms for that area. I don't know if you wanted me to be name checking those, but
we've already used that term before. You can go ahead and do it.
All right. But all of those areas, and it doesn't matter what your sexual activity, whether you're having anal sex or vaginal sex or what have you. If you're any exposure from any sexual contact, you can get it anywhere.
So that's an important point. So I just want to resurface that again. So you said before that warts are passed by skin to skin contact, but it's not all skin. So if you have a wart, even if you're carrying out sexual activity, if you have a wart on your hand, you're not going to give a genital wart to your partner, versus if you have genital to genital skin contact, that's how you're passing these genital warts along.
Generally, I don't think we really know, but generally speaking, a genital wart's not going to occur on the hand. It's not the right kind of skin. And even if you just feel your skin, you're like, oh, like when you go from the wrist to the palm, you're like, oh, the skin surface, it kind of changes, right? And so each component, there's different keratins and different distributions in different parts of our body. So that affects, what is the best, place for a wart to set up its home.
Makes sense. And so if it is passed along that way by skin to skin contact, so if you as a guy are diagnosed with a genital wart or think you have one, should you have your partner tested for genital warts as well?
Well, you have two questions there. Like, what does it mean to get tested for genital warts? There isn't really a test. There's no blood test for that. I mean, the truth is that most people are, if you are an average normal human being, you have had some sexual contact. And so most human beings have been exposed to HPV viruses and probably genital wart viruses. There's no serology antibodies to check. There's really just the physical exam, what you see. Because you can also have wart viruses in your skin and not show anything. So you can't just look at someone and say, oh, they're clear. But if you are a male and you have a history of a genital wart, if you have female partners, you definitely want to make sure they're getting pap smears in case that wart was caused by one of the higher risk types. And they talk about those frequently, which are covered by vaccines and such. And also, but even also with if you're having sex, a man having sex with men, you want to make sure that you're not putting partners at risk for anal cancers, especially if you're an HIV positive man who has sex with men. And so, you may need to be following up with gastroenterologists or people who can better detect if there's any concerning changes.
Got it. But should they, just to follow up on that, so if you discover, if you're in a sexual relationship and you discover, you went to the doctor, you found something, the doctor said, oh, you have a genital wart, should your partner go to the dermatologist or the internist just to do an exam and look for other genital warts? Is that necessary, do you think?
I don't think that's absolutely necessary because it's just exposure is so common.
Mhm.
I think as a good human being, to do
Mhm.
the respect of telling your partners if you've been exposed to something, you should, but it's in a different category than, say, HSV or HIV.
Mhm.
Whereas HPV, I mean, kind of all been exposed. So, like, I feel like you should sort of accept that if you're going to be a sexually active person, you're going to have some exposure.
Mhm.
Whereas like HSV and HIV, I mean, so herpes is very common. So you should probably accept some possibility of exposure anyway. But I would encourage people to, but it's not like it's reportable to the CDC kind of thing.
Got it. Got it. And in the same vein, again, you said it's very common, but it is again sexually transmitted. If you as a guy get diagnosed by a doctor who said, "Hey, you have a genital wart," should you get just automatically checked for other STDs, like you mentioned, like herpes or HIV or chlamydia, gonorrhea?
I think it's always a good idea. I mean, you might as well test for everything all at once, have like a firm point in time. I mean, I'm working actually this evening in the Philadelphia free STD clinic, and that's what they always do. Someone comes, there isn't a blood test for wart, so that might be what gets them into clinic. But if you are at risk for warts, there's a good chance you're at risk for some other stuff. And several of these things, especially like chlamydia, gonorrhea, syphilis, are completely curable.
Right.
So, some of those can have, some real long-term consequences if they're not addressed early on.
Mhm.
Others like HIV or HSV, you can't cure, but you can adequately treat to minimize risk of transmitting it.
Makes sense. Makes sense. So now I want to dive in a little bit in terms of, guys see all kinds of little lumps and bumps and stuff down there, and they think, is this a wart or not? The first question is, most guys know what a wart on the hand or the foot looks like. Do genital warts look the same, or how would you describe them?
I mean, warts can look like a lot of things.
Mhm.
Sometimes they can be like even just a flat discoloration. Sometimes they're more like a skin tag. Sometimes they're actually more heaped up scaly. Sometimes they can even be the big, supposedly cauliflower-like appearance.
Mhm.
I can't tell someone that a wart has to look one specific way. There are definitely a lot of things that are not warts that can be similar. For instance, right under the edge of the head of the penis, which the technical term would be the coronal sulcus,
Mhm.
often people notice little bumps around their penis and get really freaked out and worried. And those are pearly penile papules.
Mhm.
And they're harmless, they're benign growths, they're super common. They should still be tested for STDs because probably had an unprotected sexual experience. They started looking at themselves out of anxiety and then noticed this thing that they'd had their whole life, which they had not appreciated.
Yes.
But, I love when I'm able to use my knowledge to say, hey, this isn't an infection. This isn't anything. But maybe this is a time to reevaluate what your safe sexual practices are. I want you to be sexually active in the way you want, but let's make sure that we're minimizing your risk.
Makes sense. So if they're pretty I wouldn't say non-specific, there's a lot of different ways they look. Can guys help to differentiate a wart from something else based on symptoms? For instance, do they cause pain or itching or bleeding? Can you associate anything with them that way?
There usually aren't any symptoms. I would say the biggest flag is how long has it been there?
Okay.
If 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 someone comes in and says, "Oh, this bump on my penis, I've had it my whole life," it's probably not a wart.
hmm
But if you have some sort of stuck on growth below the belt
hmm
that's new, odds are it either is a wart or it can't hurt to treat it like a wart just to be safe.
Got it. Got it. And before we move on, one other thing I want to take a step back. You had mentioned about HPV, which is human papillomavirus, and I think you also mentioned in passing about a vaccine. So my question to you is, can these genital warts be prevented? I mean, with vaccines or otherwise?
So yes, so we have different vaccines. The most common is the quadrivalent vaccine that covers the most high-risk types of HPV viruses. These are the ones that are associated with cervical cancer in women, but certainly can be associated with penile and anal cancers in men.
Mhm.
So it's important that we recommend that everyone get that regardless of sexual activity or gender.
Mhm.
It can only help prevent developing a cancer, but that's only a fixed number of viruses it covers. Like I said, there are hundreds of HPV viruses. So we don't have a vaccine that covers hundreds of viruses. Who
Right.
knows what might be possible in the future. It does seem like anecdotally, like sometimes people who've been vaccinated have other kinds of warts that shouldn't have been covered get better. I
Mhm.
don't, we don't know exactly if that's true or just a coincidence. So you can prevent some of them, but it's not like you can take the vaccine and then have wild unprotected sex with lots of partners and
Right.
not and say, I'm not going to get anything. Like, no, you can still get genital warts. You're just taking some of the higher risk ones out of the equation, but you could still get a cancer or something from other types, from any kind of wart, theoretically. Those are just the highest risk.
Got it. So it can help for sure, but it's not going to give you anti-wart superpowers where you feel immune to everything, basically. I think.
It's more even just like throat cancers and things that could be associated with HPV. Certainly, it should reduce the risk of developing those kind of cancers. So to
Mhm.
me, there's no negative and all positive. And it traditionally has been pushed on women more because of the cervical cancer risk. But who are a lot of those women having sex with? Men. So everyone should be getting vaccinated.
Makes sense. No, that's a good point. And I think something guys should definitely take into account. Definitely a preventable type of situation for some very bad cancers, by the way, that you've mentioned. For sure, these are not like light and fluffy cancers, if there are such a thing. Now, one thing I want to ask you about is, guys are very reluctant to go to the doctor. So oftentimes they try home remedies. And if you search genital wart cures online, there's going to be inevitably some things that come out. So I want to kind of do run a few by you and see if they're the real deal or not. First one that I came across, and this is just me doing a search, nothing exciting. One was tea tree oil. What are your thoughts about that?
Well, tea tree oil is one of those panaceas, along with apple cider vinegar and
Oh, we love
CBD.
those.
If something is advertised to cure almost everything, it probably cures nothing, right?
Mhm. Yes.
I'm all for the possibility that it does seem like tea tree oil has certain properties that could be beneficial for certain problems, but it hasn't been adequately studied or given any evidence, certainly not for warts.
Right.
A lot of warts will go away by themselves. So I don't doubt that there are people who have put tea tree oil on warts and it got better. Sometimes just irritating the skin causes inflammation that can get it to go away.
Interesting.
I mean, that's what we do a lot. That's why we recommend duct tape sometimes for common warts. It's not that duct tape has any special properties. It just, it causes some local inflammation and irritation, which is like waving a red flag to your immune system. And theoretically that could trigger it to be better recognized, right?
Okay.
I don't think tea tree oil is worth investing any time or money into, though.
Fair enough. No deal for tea tree oil. What about, and this may be the same answers coming up, what about witch hazel?
Same.
Perfect. And green tea extract.
So that's a little different. There's actually like an FDA approved medication, green tea catechins, Verigen was a brand name
Mhm.
that was developed, and there is some data behind that. I
Mhm.
don't think it's as strong as other therapies. I would want to only use the actual formulation that's approved and prescribed.
Right.
There might be some value to that. It's just not something that I prescribe often.
Got it. And then this last one that I always remember when I was a kid seeing commercials for, but I don't see that much. It used to be Compound W, which is for warts and stuff. And I don't know if those were for genital warts or regular warts, but I wanted to throw that in there to get your thoughts.
So compound W is just salicylic acid.
Okay.
So salicylic acid is related to aspirin, which is acetyl salicylic acid. So it's anti-inflammation, but primarily helps take off the outermost layer of the skin. It takes off dead skin and causes some irritation. So it kind of exfoliates, which is why it's in a lot of acne washes.
Yeah.
Salicylic acid, it's just going to cause local irritation. So that can help stimulate the immune system to recognize warts and get rid of them. So there's nothing wrong with using that on genital warts. I find that probably salicylic acid is more effective for more common warts, but it's certainly better for genital warts than witch hazel or tea tree oil.
Well, there you go. Not a glowing endorsement, but a bigger endorsement for there. Okay, so we went through any other, by the way, home remedies that I don't want to put words in your mouth. Any other home remedies that you know of?
Just to be clear, I don't recommend any home remedies for genital warts.
Fair enough. That makes it that covers it pretty clearly.
If you think you have a genital wart, you should report to a primary care doctor or a dermatologist.
And that was going to be my next question. So, when guys finally say, "Okay, I got to do it. I'm going to go in," should they see their primary care? Should they see a dermatologist? Does it make a difference? Are they both equally equipped to take care of them?
I feel confident that primary care doctors are well equipped to handle genital warts. That said, it's a dermatologic problem. Obviously, dermatologists are better at recognizing and treating some of these things, but I think it makes the most sense to go to your primary doctor first. And if they're not comfortable treating it or they need help, or you can ask your primary, should I see a dermatologist? We're happy to help. A lot of people come straight to us, but I think it makes the most sense to go through your medical home first.
Makes sense. Makes sense. So, one of the goals of this podcast is to make the doctor a lot less threatening and the whole experience a lot less scary for guys. And so one of the things I like to ask is, okay, when the guy bites the bullet and he goes in, let's say he goes to see you as a dermatologist with genital warts, what should he expect in terms of the evaluation? By that, I mean questions you might ask, exam you might do, or any tests you might perform.
So mostly, you have to be prepared and comfortable with the fact that a stranger is going to be looking at your genitals, right?
Sure enough.
I mean, that's not comfortable for people. One reason that I have people get into gowns is because sometimes if you're not already in a gown and a little exposed, you might not mention that you have a problem. Like they say they went on a general skin check and then it's, oh, by the way, can you check this out? And
Right.
I try to create a comfortable environment. I try to expose people's bodies as little as possible at a time. I'm going to be wearing gloves. I'm trying to be respectful as it's awkward and it's uncomfortable and it's weird. But honestly, most of the time people come in and they're less concerned about that, especially since I'm a man. And they mostly want to know, how can I get rid of this yesterday?
Yes.
And I find that most men, and obviously everyone's an individual, but most men, and to be clear, I should even say most people with penises want to treat aggressively. I find that, giving a cream that might be a little weak, that could take months. Most people are like, if you got to cut, if you got to cut at me, do whatever you got to do. I want to be back in action as soon as possible. And I mean, I want people to be safe, but that makes a lot of sense that when it comes to this sort of sensitive problem, people want closure and they want to move on as quickly as they can.
Makes sense. Makes sense. Now, go just to one other question about the examination or the evaluation. You said before, and that this is a visual thing. The doctor comes in, he's going to take a look at it and say that's a wart. You said there's no lab test for it, so that's fair. Do you ever do a biopsy?
Sometimes, especially if there's. I mean, sometimes, most of the time I don't because it's clinically pretty obvious, but especially if there's any possibility of cancer, I want to make sure that I'm not overlooking anything. So for instance, I saw an immunosuppressed patient who had many large warts. I thought they were probably warts, but they're really big. They're really thick. And the person had a weakened immune system. I wanted to feel confident that we weren't missing some cancer. And fortunately, they weren't. But sometimes, especially since penile cancer or anal cancer could be a risk and could be something that could be at least locally invasive or potentially life-threatening, we'll want to take a sample. Especially in the penis, I know no one is excited about having a part of their penis cut. So I try to minimize when we have to do that. But if there's any real concern in my mind that there could be cancer, I'm probably going to want to take a sample. And then sometimes some people can't fully have confidence in that visual diagnosis. So they will even ask me to take a sample to prove it. And I'm happy to do that. But I usually try to, my mentality is usually less is more. If I can, maybe it's worth treating first. And if it doesn't get better, we can take a sample unless I have any real concern.
On a super high level, just so that guys understand, what does taking a sample entail?
Sure. So like any biopsy, we would clean the area with some alcohol, and then I would inject some lidocaine. So that's a numbing medicine, also with some added epinephrine to minimize bleeding. So there's, we say like a pinch and a burn, but it's the smallest needle we got into that area. So you'll feel it, you're not going to like it, but it only lasts for a few seconds, the pain. And then we take a little blade and we cut a little piece of the skin or the wart itself off. There'll be a little scrape or a sore that won't need any stitches, but usually just some Vaseline and some dressings, and that should heal after several days.
Got it. And oftentimes if it's small, then you're kind of curing it and biopsying it at the same time, I guess.
Yes. Yeah. So sometimes that's really satisfying. And sometimes that's one of the treatments I do. I curette them off, or for instance, sometimes, unfortunately, people make the mistake of shaving either beards or genital hair, pubic hair prior to coming in so that I can see the warts better.
Yeah.
And I inform them that shaving causes little nicks and can inoculate, meaning spread the virus over every single injury in the area.
Oh, wow.
So sometimes in those cases you can see a bunch. And so sometimes the best treatment is to like individually like remove each one, but I have to numb up.
Got it. Well, that's actually a great word of advice. Don't be shaving around warts, so you don't want to spread them, I guess, right?
So yeah, as a tangent, like there is, a belief, a fad in the culture the last couple decades that somehow less pubic hair or managed pubic hair is somehow more hygienic, which I would say is actually the opposite of true, because pubic hair actually is a little bit of a barrier between you and another human when you're being sexually active. So that's more skin to skin contact. Also, when you remove any hair, you're going to cause micro injuries that make you more susceptible for transmission of any infection. So there's no hygienic reason to remove any hair from your body really at all.
Makes sense. And that's actually also another good tip. You had mentioned a couple minutes ago in terms of creams and stuff. So, some guys are squeamish. They don't want anything cut off anywhere, particularly down there, as they like to call it. Can you tell us a little bit in terms of medications? What, like if I went to you with the wart and I said, Doc, I don't want you to do anything but, invasive or cutting or anything like that, is there any cream or medication I can take to get rid of it? What would you advise?
So some of the the creams that I often use, there's one called imiquimod, which stimulates your own immune system to attack. And so that's a cream that it comes in these little packets, and you squeeze a little bit out and put on, usually say 3 times a week. That's what it's covered for, but then we may increase the frequency depending on how you react. The scrotum is some of the thinnest skin in the body. So we tell people to be a little careful around there. And if it does get inflamed, take a break for a little while. So often that's useful. There's another medicine called podophyllin, which sometimes I apply in the office or can prescribe it as a gel. Podophyllin is actually, it's derived from the mayapple plant. So it is, it is a natural treatment, but it actually, to get technical, it inhibits cells in metaphase. It stops the microtubules from working. So to explain that better, the cells in your body that are dividing most rapidly are the ones that it will preferentially affect. So it can be helpful for, warts or cancer type things. So I often will apply that or advise patients to use that. Those are the main 2 topicals that I use for genital warts. For warts in general, I do some things use like salicylic acid, or sometimes things like cidofovir cream or injections of cidofovir, or 5-fluorouracil, which is a chemotherapy cream. I don't usually use that for genital warts. But
Yeah,
for common warts, these, I mean, these are things that some of them can be more aggressive, but like I told you, most of my patients indicate that they want to be more aggressive.
understood. Now, for the first two you talked about, the imiquimod and the podophyllin, how long do they have to be applied for to be effective? Like over what period of time?
Usually I just tell people to put them on at night. And
Mhm,
then you certainly want to put them on after washing and not put it on and immediately wash off, because you're hoping for as much of the active ingredient to get absorbed.
mhm.
For imiquimod, it's usually every night or a few nights a week. For podophyllin, it's like the podophyllin gel, it's a little bit of a weird schedule. You do it every 12 hours for, I believe, 3 straight days, and then you take the rest of the week off. And that one usually actually immediately burns and a little bit of pain if it's applied. And then you do as many cycles as you need.
Got it. Got it. And then the course generally, how, like if you're talking about the number of weeks that each one works, so how, what would you say?
So, podophyllin, when I use it, it's usually as a prescription cream, usually only a couple cycles you need.
Mhm.
The imiquimod you can use for months. Some people it works really well, other people not as much. Sometimes if someone had a lot of warts, we might even have them continue to apply every so often as prophylaxis to prevent.
Mhm.
It just depends on the particular patient.
Got it. And what kind of side effects would you expect from these type of creams, if any?
Really mostly local irritation and inflammation.
Mhm. Got
That's kind of the point. That's, sort of no pain, no gain. Like, you're trying to get inflammation. You're trying to say, hey, immune system, over here, you missed something. And then
right.
you get it. And another therapy that we use for general warts, not really genital warts, is something called Candida antigen. So Candida is a yeast that causes yeast infections. So everyone has a reaction potentially to that. So sometimes we inject Candida antigen, the protein, into a couple warts, and that's a way of waving a flag to the body. In practice, sometimes it works great, sometimes it doesn't work at all, but that's another option. You're either destroying the local cells
Mhm.
or asking the immune system to recognize it. Now, we are forgetting the mainstay of therapy, which is not a cream and is not an injection, but it's liquid nitrogen cryotherapy,
Mhm. Mhm.
freezing the warts. Now, that's the main treatment that we do for warts of any kind.
Okay.
That's locally destroying. Liquid nitrogen is super cold. It's actually negative 196 degrees.
Wow.
It's a focused, targeted burn. It'll irritate it. You'll feel it for the first couple of minutes, then it'll fade. And then the next few days, it should sort of scab off. So
Mhm.
sometimes I like to use a combination of local therapy to individual lesions, like with the cryotherapy, and then maybe a field treatment, because they're probably warts that we can't see with the naked eye if they have a lot. So
Mhm.
I might give them a cream, or in the office put podophyllin over a larger area to make sure we've really like knocked it out.
Got it. So just one last question about the creams and stuff. If you use that in isolation, what type of success rates do you see with genital warts?
I mean, usually like in a month,
Mhm.
usually things get better. Sometimes I get really lucky and it's gone after one treatment.
Mhm.
Other times it takes several treatments. I'd say the average is 2 or 3 treatments in the office coming in every month,
Mhm.
something like that. But generally, if they follow up with me and we pursue the treatment as indicated, usually can treat all of them successfully. It's just some of it is more recalcitrant, usually in the case of like HIV positive status or something like that.
Got it. Got it. And so now going into these in-office procedures, one of them you mentioned was cryotherapy or freezing. Does that hurt?
Yes, it does hurt. You wouldn't do that voluntarily if you didn't have to.
Got it. But it's pretty tolerable.
It's horrible. I mean, you feel it. You don't like. This is what I always tell people. You'll feel it. You won't like it, but we'll still be friends. I hope.
That's fair enough. I think that measures it up completely there.
I
And how
mean,
long does that whole process? How long does it take?
it takes. You do it a few seconds to each lesion, let it thaw, and then repeat it for a second cycle. So it's really fast.
Got it.
It's just, it hurts. I mean, you're exposing someone to like the coldest temperature they've ever been exposed to in one tiniest part of their body.
Got it. Got it. Especially in the sensitive part of the body, for sure. And you said that they form a scab that just falls off. Do they have any pain or discomfort during that healing phase where they go home and are with that scab or whatnot?
Not usually. I mean, there's probably some local irritation, but the most pain is in that first minute or two.
Got it. Got it. And that works pretty well in terms of getting rid of them?
Yeah,
Pretty
it's pretty
definitive?
good. It's pretty good. But like I said, it only targets the lesions that you're treating directly. It has no effect on any ones that haven't quite emerged to the surface or that are not visible. So you're only treating what you see, which is usually good enough. But sometimes you need to consider treating a little around because there probably are other cells that are infected that you can't tell.
Got it. So a couple of things so we talked about cutting them out, right, with just a scalpel, like you said, like as a biopsy or otherwise. We talked about freezing. Some of the things we also see online is cautery or, basically burning the
Yeah.
warts. Is that something that you do for genital warts as well?
Sometimes it takes a little more precaution because theoretically you could put wart into the air in the smoke plume, as they say. So
Okay.
everyone should be wearing, the patient and anyone else in the room should be wearing an N95 mask. Or we used to, I don't really don't have it anymore. We used to have this special cautery thing that like vacuum sucked the air right at the point of contact. We didn't really use it that much, so it wasn't really worth it. But that's the only risk. I mean, you also have to numb everything ahead of time because it would hurt too much if you just burned it without being numb.
Got it. So whereas the freezing, you don't need to numb up beforehand. This one you would.
No, we don't feel it's necessary. Sometimes, I guess, in certain areas we can give them a numbing cream ahead of time, but generally we don't. It's felt to not be worth it.
Got it. And then whenever we think dermatologists, we always think about lasers because the dermatologists like to use lasers. Do lasers work for warts as well?
As far as I know, some people have tried that, but there's no great evidence for it. And so it's not commonly used, especially since we have like cryotherapy probably works just as well and it's cheap and easy and covered by insurance, whereas lasers would definitely not be covered by insurance.
Got it. So it sounds like to sum up in terms of treatment, it sounds like your go-to is probably the freezing, the cryotherapy, and occasionally you supplement that with the cream. That's probably the most common approach that guys should expect for managing their genital warts.
Yeah, the typical patient with a few warts, not complicated, I probably just freeze them. If they seem to have a little more, maybe the freezing and the cream. And then we may talk about more surgical or other injections or other things if it's really getting more complicated.
Got it. Got it. And so talking about specific warts that you treat, how likely are they to return after treatment? Like, let's say, you froze it or you cut it out. I mean, are they very likely to return or maybe just in a different place?
I mean, usually we can get individual ones, but it's common to be a recurrent problem. Keep in mind that, maybe someone comes to me, they had all their warts treated and they're like, hey doc, like, do I have to worry that I still have it? And I have to tell them like your exposure could have infected cells that aren't manifesting with anything that I can see.
Mm-hmm.
If you haven't had a wart for 10 years, you're probably in the clear. But it's only infecting skin cells, mucous membranes, other similar tissue like that. Like, so it could affect your mouth, your genitals, all that. If you don't see anything for like 10 years, you probably have cleared it.
Got it.
There's no test to prove that it's 100% gone.
So it could pop back up at some point for sure.
So you can't be like, I'm clear, I'm definitely not exposing my partner to anything. You can't say for sure. But like I said, it's so common. Most people have been exposed, if not all, to HPV if they've been sexually active. Sometimes people want to ask, like, where could I have gotten it from? And I say, well, it could have been any exposure you had in the last 10 years. Unless you've only had one sexual partner, we're not going to be able to definitively say where it came from.
Well, that's such a good point because, again, you develop a genital wart and you may suspect your partner that you had sexual activity with 3 days ago or 3 weeks ago, but not necessarily 3 years ago. That's very important.
Yeah, I mean, it's not immediate. And, sometimes it's really fraught. Like I had a woman who had a wart or I think she actually had HSV and she had just gotten married and was afraid that, her husband was going to be very upset with her. And I pointed out, well, you don't know just as easily could have been the one to give it to you, even if he didn't manifest with anything. It's sometimes we want to blame, but I think as frustrating as sexually transmitted infections are, I think it's just unfortunately part of being human. And I wish that we didn't have all these stigmas associated with them. To suggest someone's been irresponsible or promiscuous or what have you, but it's just part of being human is to be sexual.
No, that certainly makes sense. I'm going to ask you a very strange question.
Sure.
So you look down there, you see these genital warts. What if you do absolutely nothing to them? You just ignore them. What's going to happen?
So there is a strategy called active non-intervention.
Okay.
Because sometimes it's reasonable to just do that, to not actively treat, because a lot of the time they were hiding out from your immune system, but your immune system at some point caught wind that they were there and took care of business. So sometimes they do clear by themselves.
Okay.
But generally speaking, if we see a wart, we don't like to wait around, especially if there's any theoretical risk of developing into a cancer. Even though the average genital wart has very low risk, it's so easy to freeze or treat it. We usually recommend to go ahead and do that.
If aside from the cancer risk, would they just, if a wart, I mean, unless it just disappears and your immune system takes over, can they grow and become bigger? Like you mentioned, the big cauliflower wart that you would come across the other day?
Yeah, I mean, cauliflower warts are just a described pattern, but I mean, they can get bigger. Usually they're individually small, but I've seen a wide variety in different sizes, and especially if they're neglected or in an area where skin is touching skin and it can spread continually. Like I've seen that like in the groin between the scrotum and the thighs, like sometimes bigger warts can happen in there or in around the anus.
Got it. And they, again, just want to touch up on the last time on that cancer risk. You said it's pretty small. Can you quantify that? I mean, if somebody has a genital wart, like what the risks are, is it like super low?
I think the risk is pretty low. Sorry about that. The risk of any individual one, I wouldn't really want to quantify. We're certainly in the like under 1% kind of like very low risk. I don't know. I'd be guessing if I said any specific number though.
Perfect. And then last question is, from this standpoint, is that when guys go to see a doctor about genital warts, any specific questions they should ask of their doctor? Anything that you would recommend that might be helpful?
I think anytime anyone goes to the doctor, they should ask, what are the treatment options? What are the side effects? And what are the alternatives? And I think it's probably an effective strategy to ask, what would you do for yourself or a family member? I don't know that it should be a different answer, but sometimes that can make people be extra honest.
That makes sense. And this seems like pretty commonplace procedures that you as a dermatologist or even primary care, I'm talking about like the freezing part, for instance, do. I mean, would it necessitate or make sense to ask like how many of these have you done, like when you talk about surgeries or whatnot?
I think it's always reasonable to ask that, but any dermatologist has done this hundreds of times.
Right.
Yeah.
Would make sense. Well, Dr. Lipof, thank you so much. This has been extremely helpful. I think that the guys will really take a lot from this in terms of both things. I know I learned a lot as well. So we really appreciate that. I'm going to leave you with one question here that I ask all our experts in Better Man Clinic that have nothing to do with warts whatsoever. At Better Man Clinics, the whole idea is try to live your best life and strive for your best self. And, as in talking to experts, they've reached a certain level of success in their lives for sure. So the question I'd like to ask you is, what is your secret to success?
Well, I appreciate you lumping me into that category generously. I think there are a lot of things that I've achieved that I've been very proud of. I think it's about identifying your core values and what's important to you and meaningful to you. A lot of people, what other people feel is successful or would be what they desire, maybe not meaningful to you. So you got to be true to your own values, and you have to make sure that you're not pursuing something at the expense of yourself. So for instance, spending time with my family is a very important value, being a good father, husband, son, etc. There may be work opportunities that advance my career that will take me away from my family. So I try my best to pick options that will both connect me with my family and improve my career. So it's not always possible. It's hard to say no to things when you start off, but I try to embrace that possibility, work on my work-life balance, and honestly, just being organized, keeping to-do lists, and holding myself accountable with deadlines, and surrounding myself with as many excellent collaborators and mentors as possible. And I've been very fortunate in my career to have incredible parents, family, friends, colleagues that have always been supportive.
Some excellent words of wisdom. Dr. Lipof, thank you so much for your feedback about warts and about life in general. I know we've learned a lot. And to all of you guys out there, thank you for listening and watching. And remember our motto here at Better Man Clinics: your best life is a journey and not a destination, and use every day to get just a little bit better. We'll see you all next time.